Of course, let's go. So this is an EMT level question. Big bad paramedic ought to be able to handle it. Let's go.
All right. What is the most appropriate EMT level
All
priority?
right. So what's the most important priority? So basically, now this could be presented as, okay, put these in order of top 3 things. This could be a drag and drop question. It could be a multiple choice. They could ask it many different ways, but the concept is still going to be the same. So let's go. Give me a story.
Okay. A 19-year-old male was ejected from a vehicle.
All right, ejected from a vehicle. That could be serious. Keep going.
Mhm. He is pale, cool, and diaphoretic with altered mental
Ooh,
status.
put all that together and give me one word to describe this patient.
Shock.
Shock. All right. The fact that he's in shock, is that an oxygenation, ventilation, or a perfusion problem?
That's a perfusion
All
problem.
right, so we got a perfusion problem. He's in shock. Is he stable or unstable?
He's unstable.
Okay, so just from that one line, I know a lot of information already. Okay, so I'm gonna keep that in mind. He's in shock, which is a perfusion problem, and he's unstable. I probably got to do something to restore perfusion. Keep going.
His blood pressure is 88/54.
Okay, he's hypotensive,
His heart rate is 138,
tachycardic.
and his respiratory rate is 32.
All right, we're seeing the same pattern again of increased heart rate with symptoms, increased respiratory rate with symptoms. And then he's got, now, the fact that he's hypotensive, is that going to be more of an early sign of shock or a later sign of shock?
That he's hypotensive, that's late.
All right, so he's probably in a late stage of shock. So that means it's even worse. It's even more important that you act quickly. Tell me about these radial pulses.
And radial pulses are weak.
All right, so that further confirms shock. Okay, he has
bruising across the lower abdomen, but no major external bleeding.
Okay, so I don't see anything coming from the outside, but across his lower abdomen, he's got some bruising here. By the way, what do you call the bruising pattern that's closer to the middle, closer to the umbilicus? What's that called? What sign is that bruising pattern that's closer to the umbilicus? What's that called?
Don't remember. Cullen's.
All right, so that's going to be
sign.
a Cullen sign. Now, what if he has a bruising pattern closer to the flanks? What's that called?
Gray Turner.
All right, that's going to be Gray Turner. Okay, so in this case, they just say lower abdomen. So where do you think he's bleeding from? So lower abdomen is close to what body part? It could be just the abdomen, but what else? What am I going to call this region?
Retroperitoneal cavity.
Okay, retroperitoneal is the word for like toward the back. They're saying the abdomen, so the abdomen is the abdominal cavity. The retroperitoneal is behind the abdomen. So this is closer to the front, but we're going to say pelvic. Okay. Now, what's so special about the pelvis is you can bleed a lot from the pelvis. Okay. And if you're bleeding a lot from the pelvis, what kind of shock could that put you in?
Hypovolemic.
All right, hypovolemic. And if you're losing blood instead of just fluid, what kind of shock do I call it?
Hemorrhagic.
That's going to be hemorrhagic shock. Okay. So we're looking for things. It's probably some kind of hemorrhagic shock. All right. So what am I going to do about it? So put this whole story together. I got a patient in shock with a perfusion problem. They're unstable and they got bleeding. So this comes down to just shock treatment. What's my first priority in shock treatment?
Control major bleeding.
We're going to control severe bleeding. Okay. Now, but that's bleeding I can see. But in this case, I don't have any major external bleeding that I can see. So what am I going to do? So what's next?
Have to get fluids.
Okay. Now, fluids is not the next thing. Fluids may be indicated, but that's not the next thing. When it comes to shock treatment, so we're going to control severe bleeding. We're going to keep this patient calm, warm, dry. We're going to maintain their oxygenation, ventilation, perfusion. Okay. We're going to check their blood glucose level. And then if we need to, we'll go with things like fluids and pressors. Okay. But there's a lot to do before I get to fluids and pressors. So jumping to fluids could cause you to miss a question because that's going too advanced too quickly. But there's a lot of basic stuff that we need to do for all shock management. So find me an answer that points to what we're going to do for this patient. Let's start with D.
B.
What
I
about D?
said
What do
B.
you think about D?
D. Wait for ALS before. No, that's delaying care.
Yep, that's going to delay care. So good. No.
Mhm.
All right. What about C?
I wouldn't give oral fluids
Why not? Because they're
because that's
hypotensive.
skipping.
What's wrong
Well,
with
yeah,
giving
but
the
that's
man some
skipping.
water?
It's not going to get to the body
Okay. The thing is,
quick enough.
because he's in shock, he's actually likely to be thirsty. One of the signs of shock that you're going to recognize is a patient will complain of thirst after the sympathetic activation. They'll kind of complain of thirst. However, it's so important that you know, hey, I cannot give this patient any fluids. But why? What is this patient's ultimately probably going to need trauma surgery, right? We don't want to have anything in their belly that can cause them to aspirate it up and end up choking or like getting it down into their lungs. So that's why we're not going to give anything orally in this case. What about B?
I like B.
You like B? Well, tell me about A.
Yeah. Perform a detailed secondary assessment before moving him. This is more so time sensitive, so you don't want to waste time with treatment.
Okay. He's unstable and it's time sensitive. I'm probably not even going to get to a secondary assessment. But also, when it comes to the buckets, remember how we have 5 buckets? Bucket number one. Bucket number 1 is all about the safety stuff. BSI, scene safety, mechanism of injury, nature of illness, number of patients, resources. That's bucket number 1. Bucket number 2 is all about the primary assessment. That's where you're going to do C-spine, general impression, level of consciousness, apparent life threats, X, A, B, C, D, E, and then transport determination. In this case, we're probably going to stay here because we got a lot to handle just in this bucket. Detailed secondary assessment comes up in bucket number 3. The reason that answer is wrong is we never do bucket number 3 stuff before we've handled bucket number 1 first and then bucket number 2. It's the wrong order. Okay, so in this case, we're only left with this. Yes, we're going to make sure we're using our C-spine precautions, treat for shock, and rapidly transport. And that's exactly what we said. We already said that he's in shock, he's unstable. We got to treat him now, and we got to do rapid transport. We already came up with that answer. Okay, let's do another one.